Hi, everyone. I'm Maggie McGrath, Senior Editor at Forbes. Health and Human Services Secretary Robert F. Kennedy Jr. is proposing a change in how vaccines are tested. Could this affect flu and COVID season and when booster shots are available? Joining us to discuss is Dr. Peter Hotez. He is the co-director of the Children's Hospital Center for Vaccine Development and Dean of the National School of Tropical Medicine at Baylor College of Medicine. Dr. Hotez, thank you so much for joining us.
Maggie, thanks for having me.
So you are an expert in vaccine development. I want to start with what might sound like a basic question, but what exactly is HHS Secretary RFK Jr. proposing, and how is this different than his predecessors? How do vaccines normally proceed in order to be available to us in the fall for flu and COVID season?
Well, it's a bit of a head scratcher, Maggie, because he makes it sound as though this is something new. We've been testing vaccines with placebo controls for the last 75 years. That's how we do it. That's how just about all the childhood vaccines are tested, like MMR vaccine and others, tested against placebo controls. So it's the way he presents it, as though this is something really, really novel. It's not. That's what we've been doing. In fact, what I've done in my social media posting on my both on X and Blue Sky, I just put up doing kind of a random PubMed National Library medicine search of randomized placebo-controlled trials, and I, just picked 7 or 8 childhood vaccines, and there they are. For anybody could do this. It's open access. You can do it yourself. So the first point why he felt the need to come up with this announcement, to me that was confusing. Point one. Now, the only point of question is whether he's only talking about new vaccines, which is what we've been doing for the last, I don't know, 70, 75 years, as I've mentioned, or whether he's also raising this issue for updating vaccines for which they've been initially tested through placebo randomized controlled trials, but then there's either an annual or semi-annual need to update them. And that's because these viruses vary their antigenic makeup over time, and therefore to improve the vaccine, to cross-react against the new variants, you have to slightly alter its composition in terms of the antigens that the vaccine is producing. Mostly, it's 99% the same, or close to it, or at least 90% the same. But there's some variation. So let me give you a couple of examples. So we ask Americans to take an annual influenza vaccine. So for that influenza vaccine, which is a virus typically grown in eggs or sometimes cell lines, those were all tested through randomized placebo-controlled trials. But for the updated version, in some cases, maybe not. We use what are called bridging studies, showing that the antibody levels are similar to the initially approved vaccine. And the better example that people will know about are COVID vaccines. So for the mRNA vaccine, each time an mRNA vaccine is updated, now we're doing it on an annual basis. It's pretty close to what it was originally, but now we use bridging studies for that. If you had to do a brand new randomized placebo-controlled trial for every updated vaccine, what that would mean is, first of all, because so many people by now have been immunized with COVID or infected with COVID to measure it for effectiveness, it would be a 1,000,000-person study or hundreds of thousands of people, which would be prohibitively expensive, and probably therefore not even practically feasible. And then you have to wonder about the ethics of it, because it would take so long to do that you couldn't rapidly have another mRNA variant in time. So it would essentially squash the program. So I think we need some clarification from the Department of Health and Human Services what they're talking about. If it's to mandate that all new vaccines that haven't gone through placebo-controlled trials to reaffirm that they go through placebo-controlled trials. Well, we've already doing it, so I don't see the need for, this is same old. We've already been doing that, and and the exact placebo is worked out iteratively between the vaccine producer and the FDA, and it's worked well for, as I say, 75 years. But if he's also talking about updating it, I think asking for a brand new randomized placebo-controlled trial. One, it's a question of feasibility, question of whether it would be available in time, and whether it really makes any sense at all.